Well, this award was given to the entire emergency department, but the pediatric emergency department plays a significant role in achieving this milestone. As a matter of fact, I believe we started years ago with bringing a new concept to patient care. I felt that looking at our patient satisfaction scores, there were always a few questions that came to mind, specifically the wait time to see a physician, poor communications. And I've diligently worked over the last 4 years to improve that. We brainstormed, and it was a team approach. You cannot just take one group, let's say a physician or the nurses, to try to make a change. You have to take everybody from the moment that you arrive, offering valet parking, to a quick registration, to expeditiously being taken back to the treatment rooms, to having a computer system that immediately alerts the physician if a new patient is. This all plays hand in hand. So it's an effort of the physicians, the nurses, the entire staff, everybody. And really important is also that you need to have the support of the administration. Clearly there had to be some accommodations. We had to hire additional people, we had to hire additional staff, we had to find additional locations so that we would not be a bottleneck that would back everybody up into the waiting room where people were waiting needlessly. And I'm very proud to say that we were able to achieve now a reduction of the time to see a physician that is now less than half an hour, and that really makes a difference. Well, we had to look at what creates the long wait time, and moving a patient from arrival to triage to registration into the room to see a physician, treat the patient, make a decision, and then arrive at a decision to either admit the patient or discharge them is a sequential timeline that added and added and added until the end. The sum of it was quite extensive. So we looked at segments. So for example, to give you an idea, when you look at registration, instead of doing the complete registration up front and asking many, many questions, we have now what's called a quick reg. 5 quick questions, you're in the system, which allows the nurse in triage to order tests for you that maybe in the past you would have waited for the physician to order. So if you had a sprained ankle, you are quickly registered, the nurse already orders the x-ray, and by the time you're put in the room, the x-ray is done and the physician has the answer. When you look at this, this really speeds up the process. Our computers are our best friends. Just yesterday I was doing a quite painful procedure, but the child was so transfixed on watching the movie, and with the help of the child life specialist, we got them completely distracted. He didn't even know the needle went in, and his finger was numb, and I drained his abscessed finger, and everybody was quite happy. If you're just sitting in a room where you have an anxious child who's completely focused on what is going to happen, that of course makes life much more difficult for me and for the parents, and I'm pretty sure the parents walked away feeling much more happier that they were in a place that is geared towards children. Well, we are ranked against 50 other pediatric emergency departments in the nation, and a lot of them are the top-notch institutions that you might want to be compared against. And we came from the bottom 10th percent to the top third now, and we're extremely proud of this achievement.